Erectile dysfunction is basically not holding erection long enough for satisfactory sexual intercourse. Now, the main difference between premature ejaculation and erectile dysfunction is with premature ejaculation, you could have strong erections, but as soon as you go in, it's gone within 1 minute. While with erectile dysfunction, most men tend to complain more about semi-erections. Basically, the erection is not strong enough. And even if it is strong enough, they lose it within like 1 or 2 minutes. So men can also have both premature ejaculation and erectile dysfunction at the same time. Now, in terms of erectile dysfunction, and that is not having erection strong or long enough to have satisfactory sexual intercourse, again, similar causes can be stress, anxiety, depression. The medical causes could be underactive thyroid, medications such as blood pressure tablets, chemotherapy, for instance, prostate surgery, neurological causes. You had back surgery, back pain, nerve impingement, low testosterone, as in testosterone deficiency can be due to causes such as chemo, which I've just mentioned. It could be due to a problem with your prostate. Enlarged prostate can cause erectile dysfunction. It could be due to a pituitary problem, such as having a tumor in the pituitary gland can also cause erectile dysfunction due to the low testosterone production. Also, it can be due to trauma to the testicle, as well as obesity, which is also known to cause diabetes and low testosterone. So usually you would want to investigate the underlying causes, such as doing blood tests, for instance, checking your testosterone levels, which is usually done early in the morning, because if you do your testosterone levels later than 11 o'clock, usually they tend to be lower than usual. So I would advise doing your testosterone first thing in the morning, which is usually around 8 o'clock in the morning, is when your testosterone production, will be quite high. You want to check for your blood sugars for diabetes. You want to check your cholesterol, because high cholesterol can lead to a deposition of cholesterol plaques in the blood vessels of the penis, which can affect blood flow to the penis. You also want to check blood pressure, because high blood pressure can also cause erectile dysfunction. And in terms of treatment, again, we're looking at treatments like viagra, which is also known as sildenafil, tadalafil, levitra, and other new generation, what we call PDE5 inhibitors that are coming to the market. Now, viagra usually lasts 6 hours, while tadalafil lasts up to 36 hours. So most men who have more regular sexual intercourse tends to prefer taking tadalafil as opposed to viagra. Most common side effects do tend to be, feeling flushed. You could have low blood pressure, for instance, dizziness, and headaches. Because what happens is basically they dilate the blood vessels because of the release of nitric oxide, into the system, which allows for you to have, more sustainable erection. Other treatments, if medication is not working, have you heard of shockwave therapy? Apparently, shockwave therapy helps to regenerate new blood vessels and it increases blood flow to the penis, and it's thought to be effective in men who find that oral medication is not working. Other options include alprostadil injections. Also, you have pellets, as well as vacuum pump erections. So these are different options. If you want more detailed information on medical treatment, why don't you check my videos on erectile dysfunction, as well as my videos on premature ejaculation. One important treatment which a lot of men tend to ignore is psychosexual counseling. A lot of men tend to ignore the stress, the anxiety and depression and rush straight into medication. However, it is quite important to realize that there is always something in the background that's contributing to this problem. So psychosexual counseling is an important element of managing sexual dysfunction. And you can access psychosexual counseling through your doctor, or you can go privately by going online and looking for a certified psychosexual counselor. I hope you found this video useful. Please feel free to subscribe to my channel.